Hi, Mr. Najib. I'm Dr. Yap. I'm an anesthetist in charge for today. And I was told that tomorrow you'll be undergoing a surgery for your right tibia. You had a fracture last 2 weeks ago.
Yes.
Yes, you have a closed fracture, was told so, and then you are told to have some interlocking nail over your femur. Right? So it's okay, don't worry. So I'm Dr. Yap. I will be the anesthetist in charge of you tomorrow for elective surgery for it. Alright? Now, I would like to take some history from you and examine in a while. Alright, is it okay for you?
Yes.
Right. Mr. Najib, may I know, do you have any medical history like bronchial asthma, hypertension, or diabetes?
No.
No, you don't have any. Good, that's good. Do you have any allergy to medication?
No.
No, you don't have any allergy. Have you done any surgery before?
No.
None. All clear?
Yes.
Very good. So, how were you involved in this accident 2 weeks ago?
It was a car.
Oh, okay.
Yeah.
And then
I
the
was
car hit you?
I was crossing the road.
I see.
Yeah.
I see. It must be very bad. Do you have any other injuries on your body? Like your chest, your abdomen, and your head?
No.
No, that's not. Okay, just your right tibia. Yeah?
Yes.
Alright, that's good. It's okay. So sad for that. But it's okay. Don't worry, we'll try our best. So, I would like to examine you further. Alright? Then examine for your mouth and also to your spine. Alright? Is that okay? Can you open your mouth, please? Alright. That's good. Alright. Can you please open up your mouth and take out your tongue? Can you say Alright, very nice. Okay, and close your mouth. I will assess your thyromental distance. It's quite good. Alright. The distance is quite good as well. Can you open your mouth again, please? So it's more than 3 finger breath. Awesome. That's good. Alright, that's wonderful. This is to see for your airway. So your airway looks good, no problem. Your teeth indentation was good. Your Mallampati is 1. Alright, and your thyromental distance is more than 3 finger breath, which is very excellent. And it shouldn't be a problem for me to intubate you. But the choice of anesthesia for tomorrow would be for spinal anesthesia. That's why I want to examine your spine. Is it okay? You can sit up very well, I think. There's no pain on the feet. Alright. I just want to look at your spine. Alright, Mr. Najib, I would like to examine your spine and your back. Alright, is it okay? Right, you can. Right, I'm going to feel for your posterior superior iliac spine. Right here. Okay, so look at the feasibility for me to do the spinal anesthesia for tomorrow. Looks like it's quite good. Right, easily felt your lumbar 4 and lumbar 5 spaces. Right, there's no lordosis or any scoliosis felt from here. It's okay. So there's no any localized infection at your skin area. So I think tomorrow we can do a spinal anesthesia for you easily without any problem. Alright. Do you have any question you want to ask? No. Hi, Mr. Najib. So that's how I assess your spine. All looks good, fabulous. I don't think I will have any problem inserting a spinal or spinal anesthesia for you tomorrow. So I would like to inform you regarding the indication and contraindication for spinal anesthesia. So for indication for spinal anesthesia includes any surgery below the umbilicus. Means that below umbilical surgery, like any surgical inguinal hernia or any femoral hernia which is not obstructed. Okay, and then orthopedic surgeries like femur, tibia, okay, fixation, which we think that is okay and able to be done in the short within 2.5 hours of duration. Alright. Urological procedure, this is one of the indication for spinal anesthesia. Okay, and of course, like, or let's say there's a mother who undergo a lower segment cesarean section, is one of the best indication for anesthesia. Alright. So in your case of the lower limb orthopedic surgery, so I think it's highly recommended. Right? So what's the benefit of this orthopedic surgery? We go for spinal anesthesia is that you will have a good pain control for anesthesia. Perioperatively means that during operation and after operation you will feel good. There's really not such much of a pain. Post-operatively can cover up to 4 to 6 hours. Alright. Thereafter, we will supplement you with some oral or intravenous analgesia. All right. Okay. So we will give local anesthesia, that is the heavy bupivacaine, 0.5%, okay, with some opioid like fentanyl or morphine to improve the quality of anesthesia at the spine. So what happens is that when we administer the drug using the spinal needle, all right, the spinal needle I will show you later. Alright, so it's a spinal needle will be inserted at your back here, okay, in the L4, L5 interspinal spaces. So during that time, you will insert the local anesthetic agent. Alright, so you feel immediately you feel numbness and your feet, like both your legs will feel very heavy. So I would like to explain to you how are we going to administer the spinal anesthesia tomorrow. Right, this is a spinal needle. Okay, this is 25 gauge spinal needle. Okay, it's orange in color. So this I will administer it at your lumbar or lumbar spine in interspinal spaces. So you insert about 3 or 4 centimeters deep only. Okay, after that you will see the cerebrospinal fluid CSF coming up. So upon seeing it, then we will administer the local anesthetic drug, which is the heavy bupivacaine, 0.5%, and opioid, which is either a fentanyl or a morphine into it, so that the quality of anesthesia will be improved, and then the duration will be around 4 hours of anesthesia. After the administration of this spinal needle and the heavy bupivacaine and the opioid into it, so about 2 or 3 minutes later, you feel your legs to be heavy, and then you feel numbness on both legs. Yeah. So that's a time when you feel and the anesthesia has commenced. So when the surgeon do the surgery, you won't feel any pain at all, but you feel that the skin, you feel some touch. Okay, that's normal for you. All right. So most importantly, you won't feel any pain. All right. So complication of it, you may have some infection, all right, or some bleeding into the spinal cord, but it's very less. Okay, it's very rare to occur, but it can occur. All right. So another one complication is hypotension. The BP will go down, the blood pressure will go down because of the drug that's being administered. But it's okay, we can resuscitate you with the fluids and also the drugs, okay, which will be put into your veins. It should be alright. Okay. So do you understand the procedure itself, Mr. Najib?
Yes.
Alright, good. So I will have the consent taken from you, and then we can ready to go for spinal anesthesia tomorrow for your surgery. Alright, we wish you a very happy evening and see you tomorrow. Alright, now I'm going to show you the steps or the procedures needed for the application of spinal anesthesia for patients who is going to undergo a lower limb surgery for Mr. Najib position. So in this case, after ensuring the patient's vital signs such as the blood pressure, heart rate, and oxygen saturation has been stabilized, so we will ensure that we have our equipment and the apparatus all ready for the performance of spinal anesthesia for our patient. So most importantly, we must have a dedicated nurse, which is we have it here, Staff Nurse Christine, to be assisting me for this procedure of spinal anesthesia. Alright, then after that, I'll be gowned out, okay, ideally in a sterile suit with sterile gloves. Alright, Staff Nurse Christine, can you please give me all the equipment necessary for the spinal anesthesia? Alright, come, Staff Nurse Christine, can I have the spinal needle, please? Alright, thank you. This is a spinal needle, 25 gauge. Can I have the syringes and the needles? Thank you. You have a 5cc syringe. And you must ensure that all are in sterile. Okay, so all are in sterile. All these are sterile. Yes, thank you. I have green needles and the blue one. Thank you. Good. Right. This is the most important thing, is the heavy bupivacaine. You can put it down here, please. Ensure the sterility. Yes, that's good. So this is the heavy bupivacaine, or the which contain bupivacaine 0.5% with glucose 8%. So this one we will inject into the interspinal space or the spinal space. All right. Okay, good. Alright, can you please pour it into this? This is the sterile prep containing the alcohol for solution. Alright, that's good. Okay, so we are ready, thank you. So we are ready with all the drugs and the equipment necessary. So for this heavy bupivacaine, you must make sure that it is not expired. So the expiry date for this drug is on January 2023, so it's safe to be administered for our patient. Okay, so make sure that it is shaken well, and then to ensure that it is well dispersed around it. And after that, we can open the bupivacaine. Alright, Mr. Najib, I'll put you sit up position. You might feel a bit painful on your leg now because of you sitting up, but don't worry, I will just take about 5 minutes for me to do this spinal anesthesia for you, alright? So don't worry. Okay, now I want to feel your spine. Okay, good. So first of all, I would make sure that all these are sterilized using the sterile prep. Okay, make sure it's all clean up. So most importantly, the skin has been well prepared and all are sterilized. So the whole bucket here are sterile, alright? So all are sterile, and we have this green towel which demarcates for sterility. Okay? Alright. For the proper conduct of performance of spinal anesthesia, so you must make sure that there is a presence of the lidocaine 2% in a 5 cc syringe. It's for the skin anesthesia. Alright, so usually I'll put in about infiltrate about 2 or 3 mils of it around the skin at the lumbar 4, lumbar 5 interspinal spaces. After that, I'll make sure that the aspiration of this heavy bupivacaine of around 3 milliliters. Alright, so 3 mils of this heavy bupivacaine should be sufficient, okay, for this patient who is undergoing a right tibial surgery. So around 3 mils is sufficient, alright. And then sometimes I will put in a fentanyl of about 10 microgram so that to improve the quality of this spinal anesthesia. So put the fentanyl about 10 microgram. So total about 3.2 okay, mils for this man who is of the height of 170 centimeter will suffice. But we must be careful. If let's say we are anesthetizing a lower segment cesarean section, okay, the patient will require a lower dose of the heavy bupivacaine because of the heavy or big uterus sitting there, which may compress or reduce the cerebrospinal fluid volume at the lumbar curvature there. So it will cause a high or total spinal anesthesia for this patient. The patient will be getting a hypotension or bradycardia. So if you administer too high of the heavy bupivacaine, the patient will develop complication in an obstetrics patient. Alright? So usually we administer lower volume for a patient like that in obstetrics anesthesia. Right. After that, we have completed our preparation of drugs. After we have prepared all our drugs and we are ready to go for spinal anesthesia, so we make sure that the patient is comfortable. Alright, Mr. Najib, we are ready to administer spinal anesthesia for you. You might feel discomfort now, but don't worry, I will be feeling your lumbar 4, lumbar 5 interspinal space. Alright, so it's here, I can feel it. Alright, so it's somewhere here. So what maybe do now is to administer the local anesthesia of the skin, lidocaine 2%. Okay, sorry, you feel some discomfort. Okay, some anesthesia, there's a wheel there. Okay. Now, Mr. Najib, I'm going to administer the drug. Okay, so after which you feel some numbness and your legs will feel very heavy. Okay, so this is the spinal needle. Okay, 25 gauge, which I will administer gently into the lumbar 4, lumbar 5 interspinal space, of which I had already demarcated earlier with the lignocaine 2%. Alright, Mr. Najib, I'm going to insert the spinal needle gently. Okay, so I withdraw, and yes, I've seen the CSF fluid coming out, the cerebrospinal fluid, and then I will administer the heavy marking. Alright, Mr. Najib, please don't move. Stabilize the needle with your left hand, and you administer your drug with your right hand. Okay, gently close the hand. Some bubble touch. Okay, see CSF coming out. Confirm that it's in CSF. Right, and then you withdraw it. And then the spinal anesthesia has been successfully been administered. So you can wash it. If there's a bleeding there, you can compress. If it's not, then you can just put a gauze over it, and you can maintain the hygiene and the sterility of it. So, okay, Mr. Najib, I've already administered the spinal anesthesia for you. So all looks good. You can lie down flat now. Alright, thank you very much. Right. So I have already demonstrated the indication, the contraindication and complication and side effect of the spinal anesthesia. So to wind up, we must make sure that we know what are the indications for spinal anesthesia for these patients. Okay, in short, it is any surgeries below the umbilicus. Okay, can classify into any surgery, orthopedic, whether is it a gynecological procedure or an obstetrics procedure such as lower segment cesarean section. Alright, so you must always make sure that there is no contraindication for spinal anesthesia. We must check the blood coagulation profile for the platelet levels, okay, to look for thrombocytopenia, of which our patient does not demonstrate any coagulopathies, alright, or any bleeding dyscrasias. We must rule this out first. And it's always contraindication in patients who is or having a intracranial bleed or patient with a reduced Glasgow coma scale. Alright. So after that, we must ensure that proper communication with the patient and our assistants throughout the procedure of spinal anesthesia, of which I had already demonstrated to you, my communication with the patient and my nurse. So withdraw the drug properly in a sterile manner before we doing the spinal anesthesia on the patient with the spinal needle. After that, we must ensure or make sure that the proper coverage or the blockade of the motor and sensory has been achieved before allowing the surgeon to do the orthopedic procedure on our patient. Last but not least, throughout the surgery, we must ensure the patient's blood pressure, the heart rate, and oxygen saturation is within the normal range with the application of proper monitoring. With this, I conclude my talk and my demonstration about spinal anesthesia, and I hope all of you will benefit from this. Thank you very much and have a good day ahead.